Hello, I will be discussing the prenatal testing obligations for patients and physicians. My name is Brittany Strauss, and I'm a student at Xavier University of Louisiana. So what is prenatal diagnosis? A prenatal diagnosis is achieved by either taking a form of DNA from the mother or from the fetus in order to test to see if there's some sort of genetic abnormality that can lead to a potential disease within the fetus. Prenatal testing for the diagnosis of particular fetal conditions has recently become an important component of prenatal care for many women. There are two different forms of testing that a mother can choose. The first one would be screening. Screening provides the possibility of risk for a particular ailment. It is less accurate. However, it also provides less risk to the mother or the fetus as it is generally less invasive. The other alternative is testing. Testing will provide a more accurate diagnosis, but the alternative to that is that it is more risk for the fetus and the mother. It is generally more invasive. That commonly arises when discussing prenatal diagnosis is determining who is the patient. Is the fetus the patient? If so, the obstetrician owes a duty of beneficence to the fetus. Then the mother would be considered the patient and the primary decision maker, and the fetus would lose autonomy. The physician should be sure to discuss the benefits versus risks of prenatal diagnostic testing with their patient. Sometimes the power to diagnose fetal conditions will exceed the power to treat them. The results can be falsely reassuring, or could possibly provoke anxiety within the parents of the fetus. When discussing the physician's obligation, it is important to establish who is the patient and the patient's goals. The goals of the testing differ depending on which of the parties is considered to be the beneficiary. If the fetus is the beneficiary, the concept of the goals of testing become a problem, as current methods of obtaining material for prenatal testing often involve risk to the fetus. Currently, actual benefit to the fetus can be achieved in only a limited amount of situations. For example, if the fetus has hemophilia, scalp sampling and the use of vacuum extractor to assist in delivery can be avoided for protection of the newborn. However, most conditions that are identified within a fetus do not have meaningful therapy techniques to correct them. Therefore, fetal testing would not necessarily be of benefit to the fetus. Now, if the mother is considered the patient, she may benefit in terms of her ability to make reasoned choices about her own reproductive matters, as well as be provided with reassurance about the health of her baby. The consequences of the mother being the patient is that the test has physical and psychological risks. The test also raises a number of important ethical issues, including the issues of informed consent, the appropriate indications for testing, privacy, confidentiality, and the appropriate allocation of testing services and follow-up treatment. Prenatal diagnostic testing can limit a woman's Prenatal diagnostic testing can also limit a woman's sense of control over decisions made about her pregnancy. When she receives the results, it is up to her to maintain her own autonomy and to prevent the influence of others in making her decisions regarding herself and the fetus. Understanding the types of prenatal testing provides perspective and the weight of the decisions that the mother has to make when trying to determine the health of her fetus. As mentioned, there are three forms of genetic testing: diagnostic testing, which involves identifying current disease states; carrier testing, which determines whether an individual carries a genetic trait; predictive testing, which is used to determine whether a person has a genetic mutation that will lead to late onset disorder. Screen testing would be considered a type of predictive testing. It provides information about the chance that a fetus has Down syndrome or other related chromosomal abnormalities. The advantage of screening testing is that they are performed by drawing a sample of blood from the mother without the use of more invasive techniques. Examples of current screening tests that are used in prenatal diagnostic testing includes the triple screen, the quadruple screen, first trimester aneuploidy screening, and cryonic villus sampling. There are two commonly used methods to genetic testing. One includes amniocentesis, which is a procedure in which an amniotic fluid is removed from the uterus for testing or treatment. Amniotic fluid is the fluid that surrounds and protects a baby during pregnancy. There are a lot of risks that come along with this genetic test. Risks include miscarriage, leaking amniotic fluid, needle injury, and RH sensitization. The second most used genetic test is called chorionic villus sampling. It is a prenatal test in which a sample of chorionic villi is removed from the placenta for testing. The sample can be taken through the cervix or the abdominal wall. Similar to amniocentesis, this method of genetic testing offers risks. Risks include miscarriage, RH sensitization, and infection. The discussion of the ethical concerns of prenatal diagnostic testing can become lengthy, as there are several controversial topics of this method of testing, one of which includes privacy, as the results that the mother receives about her fetus's genetic testing is open to other third parties, such as employers and insurance companies. Another ethical concern includes the socioeconomic differences between class. If the affluent continue to have disproportionate access to technologies, such as chorionic villus testing and amniocentesis, then being genetically disabled could potentially become a mark of a social class. Furthermore, it becomes important to protect patients from the possibility of stigmatization from insurance companies and employers. And in 1996, HIPAA prevented insurance companies from denying health care based on predicted testing. It becomes important to maintain the privacy of genetic information and make sure that it's adequately protected to ensure the safety, both physically and psychologically, of patients. Which brings us to the next topic of confidentiality. Some physicians argue for confidentiality as it is their duty to maintain confidentiality between themselves and the patient. However, other physicians feel that they have a duty to alert family members and other members that could be possibly affected by the potential results of the genetic information. Societal views also play a large role in prenatal testing. The availability of prenatal diagnosis may in fact limit autonomy rather than enhance reproductive choice, especially if a woman is considered irresponsible by her family if she decides to not be tested. Furthermore, there are two large perspectives concerning the societal views of prenatal testing. One includes the utilitarian perspective. This perspective believes moral decisions should be decided by calculating a burden versus benefit ratio from a societal viewpoint. This perspective promotes the good of society over that of the individual, meaning, if there are multiple people at risk, they should be informed. They believe this as informing at-risk family members may decrease the intensity of pain, duration of symptoms, and increase the potential fetus's quality of life. In opposition, there's the libertarian perspective. They believe personal autonomy has the highest moral value. Each person has the right to make his or her own informed decisions, and individuals have the right to privacy, freedom of speech, and freedom from harassment. Meaning, for them, it is up to the individual to make the choice to tell their own family members. In order to maintain the psychological health of the mother throughout this prenatal testing, counseling should be implemented in the physician's plan. Pre-test counseling should provide accurate information about the testing procedures and the risks involved, including possibility of ambiguous results. Physicians should also discuss both medical and social consequences of testing and gain informed consent from the patient. The counseling during and after the prenatal testing should include a discussion with the research participant about whether she wishes to give permission to use her samples without identifiers for other types of research. She should also be informed of the institution's policy regarding recontacting participants in the future. The American Society of Human Genetics states 3 things that should be included when counseling and communicating with the child and the family about genetic testing. 1 includes the assessment of significance of the potential risk and harms of the test. The 2nd is the determination of the decision-making capacity of the child, and the 3rd being the advocacy on behalf of the interests of the child. The future of prenatal diagnostic testing lies in our current legislation and future legislation. Currently, Congress passed the Accurate Education for Prenatal Screenings Act, which would launch new educational programs about the nature and outcomes of prenatal genetic testing for expectant parents and medical professionals. In this act includes the Public Health Service Act, which directs the Center for Disease Control to develop, implement, and maintain two programs, one to educate patients and one to educate healthcare providers regarding the purposes and definitions of cell-free DNA prenatal screenings, the reasons for patients and providers to consider such screenings, and the conditions such screenings may detect. Furthermore, there are now legal repercussions for doctors who partake in prenatal diagnostic testing, one of which includes the wrongful life claim, which is typically brought by a parent or a guardian on behalf of a minor child with a genetic or congenital disorder seeking to recover damages for the healthcare provider's alleged negligence. This can be either in the preconception or prenatal period to predict or diagnose the child's genetic disorder. Finally, abortion laws are potentially becoming more strict, which can constrain the mother and her choice to engage in prenatal testing, as she may lose certain options that are currently available to her. Those who argue to test are arguing for the rights of autonomy for their patients. They believe that the patient should be left with the decision of whether or not they want prenatal diagnostic testing. They also believe that the patient has the right to the genetic information of their child and themselves, regardless of the possibility of a late onset disease. Those who argue to avoid paternalism do so as they do not believe that the physician should make the decision that the patient should not receive prenatal diagnostic testing because of the possibility of anxiety. Thank you, and that is my presentation on prenatal testing and the obligations for patients and physicians.